The human body has many ways to maintain a stable blood pressure. This is necessary to sustain life and ensure circulation of blood to all vital organs. In this video, we will discuss the osmotic pressure gradient as it relates to the antidiuretic hormone and filtrate formation of the kidneys. Some preliminary information. Osmotic pressure concerns two individual concentrations. The concentration of the solvent is what a substance is dissolved or suspended in, usually water. The concentration of the solute is the substance suspended or dissolved in the solvent. Note how these words are close spelling and pronunciation together. You must study these in order to differentiate between the two. Note the difference in the lower right-hand corner. Which is in greater concentration, solvent or solute? And note the direction water is moving. In summary, as the concentration of solutes go up, the concentration of the solvent would go down, meaning usually less water. The inverse is also true. As the concentration of the solutes go down, the concentration of the solvent would increase, usually more water. The antidiuretic hormone's effects on filtrate formation. The osmoreceptor is located in the hypothalamus. Its purpose is to detect a change in osmotic pressure of blood. Its stimulus is an increase in osmotic pressure. Apply your knowledge. If osmotic pressure increases, what would be in greater concentration, plasma or colloids? Once the osmoreceptor is stimulated, it transforms this into a neural impulse. Note, not a neural stimulus. This impulse travels through the infundibulum to the posterior pituitary gland, which stores ADH, or antidiuretic hormone. After the impulse is received, ADH is released into circulation. The target organ of ADH is the kidney, in specific the nephron. This hormone increases water permeability of the nephron ducts, allowing water to be reabsorbed back into circulation. Apply your knowledge. What would be urine's general composition without this hormone in circulation? Dilute or concentrated? Epidemiology or cause. Because the hypothalamus detected an increased osmotic pressure, it sent an impulse to the posterior pituitary. The increased osmotic pressure is due to a decreased blood volume. Plasma is primarily composed of water. Without it, solutes couldn't dissolve or even be transported. Apply. If the concentration of water was low in your blood, would you have more or less? The mechanism is of course supported by many other factors to increase blood volume/pressure if it gets too low in a sudden event. 120/80 millimeters per mercury is a normal blood pressure necessary to sustain life and maintain blood flow to all vital organs. Other factors contributing to this are constriction of arterioles, the angiotensin-aldosterone mechanism, and an increased heart rate. Clinical application. A male client is admitted for a treatment of syndrome of inappropriate antidiuretic hormone. This syndrome is marked by an increase in ADH in circulation. Which nursing intervention below is appropriate for treatment of this client? Would the nurse infuse IV fluids rapidly as ordered? Encourage increased oral intake? Restrict fluids? Or administer glucose-containing IV fluids as ordered? In order to reduce water retention, the client with SIADH, the nurse should restrict the fluids. Administering fluids by any route would further increase the client's already heightened fluid load. Increasing fluids further would lead to hypotonic hydration or water poisoning.